So within our team, to take students on outreach happens in different ways. So our audiologists have been able to set up some student placements for going to our more rural communities or towns, and in those cases the students have had to pay their own way. So if they can get funding internally from the university or through other sources, that supports them to participate in that sort of outreach activity. But because that's quite defined to a very clinical role, that's very different to our speech pathologists and occupational therapists in our team work. So for us to be able to take speech and OT into our work, which doesn't just sit within the health centre but within many different services, organisations and parts of the community, we need to make sure that first and foremost we have a really good relationship with the community, and that if we are taking a student with us, that's gone through a consultation process with the key people in the community, so from council and the local health centre and any other places and spaces that the student will be with us in that time. I suppose our preference is to have the students on a fairly short visit. So lots of our visits to community will be over sort of 3 or 4 days, and we probably prefer to take students on shorter visits because sometimes it can be quite overwhelming, or they might have not been in that context before. So we want to make sure that they feel safe and supported, and also being together for multiple days with your supervisor might just challenge that supervisor-supervisee relationship a little bit. So we need to make sure that I suppose that professional delineation is maintained as well. Some of the things that we've done to overcome the logistical barriers, we've been able to sometimes we just we can make sure that there's 2 beds in the motel room so that the student doesn't have to pay for additional accommodation. That we tend to take students to communities where it's quite a short travel distance, so that there aren't flights involved, that they can jump in an extra seat in the car. And there's only a handful of communities that we visit from OT and speech perspective that we can actually do that with. I suppose that what's really important, particularly in going to remote Aboriginal and Torres Strait Islander communities, is that the communities don't see students as coming and sticky beaking, or that the students are there to learn and understand from the community, and that we will make sure that they would meet with community members to hear their perspective and to understand their context from the community's perspective. And that's really hard to do when you're up there to do your job as well. So we've got to take all that into account. The benefit for us in taking students is that because we're more of a population health model, we don't see individual clients, so that sort of diminishes risk a little bit, but we still are very protective of the communities we visit. So we need to make sure that, if for example we had a student who we thought might not be practicing in a really culturally safe way, we might make a decision within the team to sort of say, I don't know if that student's actually ready to visit the communities, because we don't want to risk our relationship with the community just for the student to have 24 hours of that experience.
What do you think?
The advantages for students to visit the communities that we work in partnership with are just to know and understand way of life in remote communities, to really get a feel for the geographical isolation, and for the services or sometimes lack of services that people have, even from a visit to the local shop and seeing how expensive it is to live in that community, a visit to the local health centre to see that the optometrist isn't coming for another 2 months, or all those sorts of things that until they're in your face, you just don't understand the isolation of some of the communities. And also from a cultural perspective, just being able to meet local people, hear their stories, which, just for a student, I think that's the stuff that I would have liked to know before I graduated.